My name is Marissa Rivera, and I'll be demonstrating the anterior posterior load and shift. So what I'm going to start out with is taking his humerus and loading it into the fossa, and then shifting it anteriorly and posteriorly. And then what I'm looking for is either laxity or movement greater than 25%. I'm going to test it bilaterally. And then a positive test, like I said, would be the laxity. And then we're testing for glenohumeral instability. Okay, so now I'll be performing the apprehension test. So what we're looking for is anterior instability. So I'm going to take his arm out to 90 degrees off the table, and then I'm going to externally rotate it. And then a positive sign for the test would be apprehension. Okay, now I'll be demonstrating the posterior apprehension test. So what this is assessing is instability posteriorly. So what I'm going to do is take his arm, flex it in front of him, and then I'm applying axial load down into his shoulder. And then a positive sign for the test is apprehension. Okay, so now I'll be performing the sulcus sign test. So for this one, I'm going to have him sitting up, and then I'm going to take his arm and I'm going to pull down. And then I am assessing for inferior instability, and then a positive test would be if he had any dimpling or divot in his arm. Okay, so now I'll be doing the shear test. So what we're assessing for is an AC sprain. So I'm going to put one hand and find the spine of the scapula, and then put the other hand on the clavicle, clasp fingers, and then press together. And then a positive sign would be laxity or pain. Okay, so now I'll be demonstrating the drop arm test. So what we're assessing for is rotator cuff injuries. So what I'm going to do is have him bring his arms up to 90 degrees, and then he's going to controllably bring them down to his side. Okay, and then a positive sign of this test would be uncontrolled movement or pain. Okay, now we'll be doing the sternoclavicular joint integrity test. So what we're assessing for is an SC sprain. So what I'm going to do is find his clavicle, and then press down on his clavicle, and then a positive sign is laxity.
Hi, my name is Eric Pena, and we'll be performing the empty can test. So we're testing for possible weakness of the supraspinatus, and we would have to ask our partner to, you'd bring your partner's arms up to a 90. We might have a 45-degree angle. We would then ask them to empty a can, so they would move their forearms to pronate. And then you'd instruct them to then resist the force you're about to put on them. And then a positive sign test is weakness. So for example, you would see one arm start to lower down the other. Alright, we'll be doing the infraspinatus strength test. So you want your patient to flex at the elbows, and this can be done unilaterally or bilaterally. And then you're going to have them externally rotate the humerus. In this case, they'll just be opposing the resistance I give them. And then a positive test for this is you see any weakness between both of the arms.
The stop button.
Alright, we'll be doing the speeds test, and this is to test for any pathology to the biceps brachii. So we have our partner have them resist this, the resistance you give them through a full range of motion, and you're having them flex all the way to the top. And then from here you can take a second, and then you will instruct them to hold that position while you put a force down. You test this bilaterally for any signs of weakness. So now you do the other hand, she resists all the way to the top. And then from here, you take a second, and now she resists from the top. Alright, we'll be doing the pectoralis major contracture test. For this test, you want to instruct your patient to put their hands behind their head. And then we're seeing if their elbows are able to reach the table. And for example, if their elbows are not able to reach the table when they perform this action, it is a positive test for tight pectoralis major muscle. We'll be performing the Hawkins-Kennedy test, and we're testing for possible impingement pathology. And so to perform this test, we would want to bend our patient's arm at the elbow, as well as passively raise it up to 90 degrees on the shoulder. And then one hand on the elbow and the other hand on the wrist, we're going to internally rotate. And a positive test for this is they experience any sort of pain when we do that. We will be performing the crank test. To perform this test, we are going to want to have our patient's shoulder move to 160 degrees. We would then put one hand on the wrist and then one on the elbow, and we'll provide an axial load to the body, and then we're going to internally rotate as well as externally rotate. And what we're hearing for is if there's any clicks or if they're experiencing any pains, and that would be a positive test for a labral tear. We'll be doing the compression rotation test, and to perform this test, we're going to instruct we're going to relax, and then we move their shoulder to 90 degrees, bending them at the elbow, one hand on the wrist, the other hand on the elbow. We're going to provide an axial force, and then we will begin to internally rotate as well as externally rotate, and then we're trying to see if they're experiencing any sort of pain. That would be a positive test for a tear to the labrum.